This presentation is over elbow hyperextension. The involved anatomy of elbow hyperextension includes bones, ligaments, and tendons of the elbow. First are the bones, and those include the humerus, radius, and ulna. These three bones make up the three joints of the elbow, which are the proximal radial ulnar joint, humeroradial joint, humeroulnar joint. Then there is the anterior joint capsule that could get stretched during hyperextension. Next are the ligaments, which are the ulnar collateral ligament, the radial collateral ligament. These two ligaments are the main ligaments involved. Lastly, the tendons involved are the biceps brachii tendon and the triceps brachii tendon. The pathology of elbow hyperextension is when your humeral ulnar joint bends backwards and out of its normal range of motion. In this picture, you can see a lady whose elbow is in hyperextension. The predisposing factors for elbow hyperextension are contact sports, such as boxing or football, also other vigorous sports like gymnastics and weightlifting. Age can also predispose an individual to this injury because as we age, our bones and ligaments get weaker and more likely to be moved out of their normal range of motion. Lastly, any previous injury to the elbow can make the joint weaker and more prone to another injury. The main mechanisms of injury for elbow hyperextension are a blow to the arm when the arm is already fully extended. This blow can be a posterior force when the arm is weight-bearing, or it could be an anterior blow when the arm is not weight-bearing but still fully extended. Also, falling on an outstretched hand where the elbow is fully extended can cause elbow hyperextension. The main signs and symptoms of elbow hyperextension are pain and a popping sound heard at the moment of injury, pain in the anterior aspect of the elbow joint when straightening the arm immediately after injury, elbow joint painful to touch, muscle spasms of the biceps muscle immediately after injury, swelling around the elbow joint, loss of strength in the arm, and numbness in the arm. A differential diagnosis for elbow hyperextension could include an ulnar collateral ligament sprain because the mechanism of injury is hyperextension and the pain will be very similar, an epiphyseal fracture because the mechanism of injury for this is also hyperextension and falling on an outstretched hand, and the signs and symptoms will be very similar. And lastly, it could be radial head fracture because blunt force and falling on an outstretched hand can cause this injury, and the pain will mimic that of elbow hyperextension. Besides watching an athlete perform active extension and looking for an extension past natural range of motion, there is only one special test for elbow hyperextension, and this is the elbow hyperextension test. This test is performed with the patient sitting or standing and the examiner grasping the distal humerus at the lateral medial epicondyles with one hand and grasping the distal forearm with the other hand. Then the examiner passively extends the elbow until no further motion is available, as shown in the picture. Elbow extension beyond 0 degrees is considered hyperextension. A positive test could indicate a torn or stretched anterior capsule. This test should always be performed bilaterally. The treatment for elbow hyperextension includes rest, which means don't do anything that might aggravate your elbow even more and cause pain, ice to help combat swelling, non-steroidal anti-inflammatory drugs to help with pain and inflammation, apply compression to also help combat swelling, support the elbow by using an elbow brace or tape, and lastly, a slow return back to normal daily activity and sport activity. Where there are mulligans in joint mobilization for the elbow, there is nothing specifically to help with elbow hyperextension. Immobilization may be necessary in some cases, but most of the time you are going to want to be able to move your arm so it doesn't get stiff, but only do what doesn't cause pain. For referrals, you may want to refer for an X-ray or MRI to make sure there is nothing else wrong, such as broken bones or torn tendons or ligaments. In some severe cases, surgery may be needed to repair ligaments and other structures in the elbow. To prevent elbow hyperextension, besides simply avoiding contact situations and avoiding falling on your fully extended arm, you can use supportive braces, like this one that is pictured at the top, and you could get a supportive tape job that is shown in the bottom pictures. These pictures show a step-by-step guide on how to do this tape job. This is just one of the ways you can do this. There are other ways that use different types of tapes. The steps, however, are still pretty much the same. The study I looked at for my PICOT analysis was about trying to describe elbow problems among goalkeepers in team handball using 2 questionnaires. The population was 329 goalkeepers and 166 court players during the first questionnaire, and about 590 goalkeepers during the second questionnaire. There was no intervention. They compared different elbow problems among goalkeepers and whether the goalkeepers had previously had elbow injuries or not. The outcome was that many goalkeepers suffered from elbow pain and disability, which can be described as handball goalie's elbow, brought on by repetitive hyperextension of the elbow. The time was 2 years. Thank you for watching, and I hope you enjoyed this video over elbow hyperextension.